People don't care about your chronic pain until it happens to them. I don't know that it's that they don't care about it, they just don't understand it is really what it is. I've had many times where I have thoracic outlet syndrome, which is up here, and then I have lower back pain, so I've had 3 back surgeries. So usually I will talk, if people ask me about things, people ask me what I do, I say, well, I'm a disability because I have, 3 back surgeries. That's usually what I'll tell them, and they understand that. If you talk about thoracic outlet syndrome, they get lost. They don't even know what that is. But I've had many times where people have hurt their back and then they come and talk to me and like, man, how do you do it? This is so painful. How do you deal with it? And it's like, I don't know, you just deal with it. I mean, you have no choice, but until it happens to a person, to someone else, and they experience, then they get it, and then they're always complaining about it. It's like, man, I don't know how you do it, or I don't know how much longer I can deal with this. And it's like, it's just it's a totally different perspective with anything in life, really. Until you experience something firsthand, you really don't get it or understand it. When I first started this channel, I talked about thoracic outlet syndrome a lot, and problem was I wasn't getting too many views. And there's this guy, Tim Schmory, he had a channel that teaches you how to grow your YouTube channel, and I asked him, I told him that in the comments on his channel on one of his videos, I said, my problem is I have thoracic outlet syndrome, and it's so rare that really limits the audience because nobody knows what it is. And he said, well, you know what? Chronic pain is a huge deal. So what you can do is talk more about chronic pain in general and just use that as your example of, what your problem is, what you experience. And I thought, that is a pretty good idea. So I did start doing that more because of what he told me there. And the thing people don't understand about chronic pain too is it fluctuates. It's like, you can look pretty good. I can look pretty good. You look at me, I mean, I look pretty healthy, but there's days when, I feel fairly good and I can get out, do a little bit, and I'm not doing too bad. But then there's other days, it's actually the flare-ups of what really screw you up, like where, everything, like the pain gets worse, everything gets really tight, the muscles get really tight, especially with thoracic outlet syndrome. The muscles in your neck, your shoulders, your arms get really tight. And sometimes those flare-ups drag on for weeks or months, and they really wear you out. And the thing is, say you went for 6 months without a flare-up, you kind of start to forget how bad the pain is, and then sometimes you'll do things that you probably shouldn't do that end up flaring you up because you forget how bad the pain is. And then once you get in that flare-up mode, you're like, oh man, I forgot how bad this is. I wish I wouldn't have done that. So there's a lot of times where I just don't do things, for that reason. Sometimes I can get away with certain things and sometimes I can't. And so it's hard to ever know like when it's going to get you and when it's not. So there's a lot more to living with chronic pain than people think. It's not just like, oh, you have this certain level of pain, it's the same every day, and you can take these certain pills and it brings it down, and then you can live a normal, just happy life and everything is fine. People just don't understand what you have to deal with on a day-to-day basis. It's like really hard to plan anything because you really don't know how you're going to feel from day to day, and it varies a lot. So it's not that a lot of people are like, have no compassion or they don't care. They just don't, if they haven't experienced it, they just don't get it. But it's always funny how as soon as someone hurts themselves or does something, then they're complaining and whining and sometimes I'm just kind of smiling about it because they're, it's like, okay, now you see what I deal with, like pretty much my whole adult life. I've been dealing with chronic pain since I was like 17 or 18 years old. So that's when my TOS started bothering me. So, it's just, people have to see things for themselves before they get it. Anyway, that's my video for today. Thanks for watching. See you guys next time.